Chadi Alraies from New York EVS. I'm really privileged to be with one of the patients who was treated at Mount Sinai, Mr. Patrick Curran, to tell us about his story and how his disease kind of evolved over time.
So
Patrick,
I'm a diabetic patient for about 20 plus years, and I've had last 5 years, I've been having problems with my feet, where I've had osteomyelitis, I've had MRSA, and had to have surgeries and bones taken out, and basically all diabetic related and cardiovascular related. I do have 13 stents in my heart to go along with and add to the problems. So, but the feet went about 5 years ago. Been going to the doctor, to a podiatrist constantly to make sure that I didn't lose my feet, and got to the point where I was told I had the peripheral artery disease in the legs, and I needed to get a doctor at one point while I was in the hospital turned around and told me I would need. He performed an angioplasty and then couldn't get down the left leg, and told me I needed a bypass. When I left the hospital, I told him I didn't want the bypass at that time. I wanted to have other second opinions, and I went back to my podiatrist. My podiatrist recommended me. Well, my podiatrist was Dr. Hall. Recommended me to go see Dr. Tufik Safa over in Long Island. He was affiliated with St. Francis Hospital. I went and I saw Dr. Safa, brought my records. He's like, no, I think we could get through. And Dr. Safa performed an angioplasty, but he went through the top of my foot and was able to open up the artery and get blood flow going. So it was a success. I needed it again because it closed up.
How long after?
Probably about a year, maybe a little, give or take. And that was great. He did it again. And subsequently again, probably another year later, I needed another one because the blood flow had stopped again. When I went to Dr. Safa, last time he performed an angioplasty and he was not successful. I also, before I went to Dr. Safa again, I had another angioplasty done by Dr. Connolly in Columbia Presbyterian. He's like, no, I can't get down. You need a bypass. And then in talking again to Dr. Safa had recommended me to go see Dr. Krishnan at Mount Sinai. And he's like, he's the professor. He knows, he's got different tools than I do. He can probably, help you out. I went and I saw Dr. Krishnan just this past May. And actually sometime in January or February, and had the angioplasty done, and Dr. Krishnan was successful and got through and gave my blood flow back to my foot. Subsequently, at a follow-up, Dr. Krishnan was examining my foot. I have a diabetic ulcer, and he was looking at it, and he's like, it didn't close yet. You might have to go back in and open up another artery, get you more blood flow. So with that, after having 2 angioplasties where it didn't work, and then 2 angioplasties where it worked with Dr. Safa, I was like, Dr. Krishnan, why can't somebody come up with a stent? And why can't we put a stent in my leg and keep the artery open and the flow running? And he looked up at me, he's kind of with a smile, he was like, you know something? He goes, we just got approved by the FDA for a stent. Told me it's a degradable stent, and that we can, it's FDA approved, and you fit the profile. I think it would work, and it would keep you, the artery or the vein open and constant blood flow to your leg. So I asked him, I says, is there any constraints with it, contraindicating with my medical conditions that I have, that would not, not be advisable for me to have the stent? He's like, no. He goes, you're it. You're the perfect patient. So I was like, okay. So I says, when do we want to do it? He goes, I'll see you Tuesday morning. So I went in Tuesday morning, and they performed the procedure, the angioplasty. I was told I'm the first person in America to get it as a commercial patient under hospital insurances and stuff like that. And I was like, all right, fine. And I saw him afterwards, and I was like, yeah, it's working. I said, I got great blood flow. I went back to Dr. Safa. He did a type of pressure testing, and Dr. Safa goes, your leg hasn't looked this good in 3 years.
Wow.
He goes, the wounds are great, they're healing, the blood flow is fantastic. He goes, the leg is nice and you know, good color. The wound is nice and pink. So he goes, everything's a success.
Nice.
So I was like, great. And then, you know, here I am today. I'm walking. I have a wound, but it's healing. It's gotten smaller.
Nice.
And, you know, I'm going to be able to do things I enjoy doing, riding a motorcycle. I'm a volunteer firefighter, so I'll be able to, you know, help. And whatever I can do with this procedure to get the word out is you know, it's got to get out.
Absolutely.
People have to get this done.
Because
you know,
a lot of people have the same problem you have.
Correct. Peripheral artery disease is a
And they feel that's
big
it.
deal. You know, they don't think there's any help out there. I've told 3 people personally to go call Dr. Krishnan's office and go get examined. You know,
You don't want to lose the foot.
Yeah, you don't want to lose anyone. You know, so.
Well, congratulations
that's
again. This
story.
is what an enlightening story again. But that speaks also to you, persistence, right? You are persistent.
You have to be.
You have to
to
speak
be.
up for yourself and be advocate.
I mean, my problem is the diabetes, and I should be a better diabetic patient. I do take my medicine, you know, but it's, you know, sometimes it's just.
When there's a wound, it's hard to heal,
Right.
but that's why you have to have the right team around you.
Exactly. And Dr. Krishnan and the people from Abbott, I can't say enough and thank them enough.
Yeah.
So I'm going to have my limbs. I'll be able to walk my daughter down the aisle at her wedding.
Nice.
And, you know, whatever I can do to help to get the word out.
Congratulations, Patrick. Great story.
Thank you very much.
I'm very happy
Chadi.
for you, and everybody, I think, listening to us, happy for you having had this wound closed, and soon will be completely healed and back to action.
Absolutely. Get it done, get checked, be persistent with your doctors.
Thank you. Thank you so much, Patrick.
Thank you very much.
Watch these videos and others on the YouTube channel. This is Chadi Alraies coming to you from New York AVS 2024. Thanks, Patrick.
All right, Chadi. Thanks.
Great.
Nice
Thank
meeting you.
you.